I just kind of wanted to talk about health things for a minute, and what happened. I have psoriasis and I also have psoriatic arthritis. So I typically wear a knee brace on this knee. It's in my knee and it's in my left hip and then in this index finger. It's a progressive joint, I guess you could say disease. I don't know if you would say disease, but it is progressive. And basically the only thing that you can do is try to slow down the damage. And I take biologics, so I have to take a shot to keep my psoriasis down. This is not psoriasis. This is me getting sunburned a few days ago and not having lotion to kind of help with that. And it is hot, so I'm fixing to spray myself down with everything. I do have this. Somewhere I have the spray stuff. And I have a bottle of, I had a bottle of regular, whatever, sunscreen. That's not spray. Anyways, so, I also have I said I had arthritis. I also have asthma. And so, typical albuterol inhalers don't work for me, so I take the Zopanex, which is actually like albuterol, but it's basically one molecule over. That's what was explained to me, and it's, for some reason, it just works better for people, and that's what I use. So I do need to get a new one though, and so I hadn't taken that when I went. Luckily, it didn't affect me too bad, but I didn't end up with like an asthma attack or anything like that, so I'm good with that. But it does start getting hard whenever I'm like moving things around. Like I'll start getting out of breath real easy, and it's not because I'm out of shape. It's just because I have asthma, and it's exercise-induced asthma. And so the last thing is, I actually found out a long time ago, because I used to spend a lot of time in the hospital. We didn't know what was going on. My body just started rejecting everything. Basically, I kept throwing up. I would end up dehydrated. I would end up very, very sick. I would not be able to stop vomiting. And I went through so many different procedures. On the first stay that I had in a hospital, I was there for 2 weeks. I lost a lot of weight then, and I was very, very ill. They had an IV pump, and this thing had like 5 different wires going into my veins. So my veins are pretty shot. Anytime anybody needs to do a blood draw on me, I'm always like, I'm hard hit, and I am. And one of the stays I have had, they did give me a PICC line, which is actually a line that kind of goes up and into your neck and into your heart, which actually sounds terrible, but I find them way more comfortable than IVs. I'm sorry, I'm just sitting here putting this lotion that I can, because it's just, my skin's so dry. So anyways, I was in and out of hospitals all the way into my mid-20s, and it wasn't until 2016 that they actually gave what was going on an official name and diagnosis. They were already calling it something. They were looking into it. The first study for it was in Australia and was called as Cannabinoid Hyperemesis syndrome. So basically, I can't smoke pot. I don't know if YouTube's gonna be like, but this is educational purposes, okay? So I can't smoke marijuana because my body does the opposite of what it does for a lot of people that have like illnesses, and you know, they always tell you if you can't eat, then to use marijuana substances as a way to kind of help, like with cancer patients, like, you know, it's supposed to help with appetite and stuff, which of course that stuff does. For me though, what they've discovered, and what they're discovering a lot more now, especially because things are becoming legalized, is they're seeing a lot more cases of people getting this cannabinoid hyperemesis syndrome. They had defined something now as scromiting, which is vomiting and screaming at the same time. I am so afraid of getting nausea. nausea and throwing up. Like I have a fear of that. There's a word for it, I can't remember. So anytime I get any kind of medication for my stomach, having vomiting syndromes and stuff, dude, I save that stuff. As much as I can, I will like use as little as I can just so I know that I have it. Because I still do have episodes. Even though I don't use anymore, I still have episodes, and I think that's just maybe, there's still a lot of research that needs to be done, of course, but they're definitely getting a lot more information now because of it becoming legal in a lot of places. But unfortunately, that just become something that has developed over the last 10 years. Well, more than that, almost 20. And so I got sick the first time in 2005. And at that point in time, that's when I stayed for 2 weeks. What ended up happening during that stay, and this happens a lot when people don't know what's going on with them. Thank God, like, people are actually finally figuring this stuff out. But I ended up having my appendix removed. That's what they did. I had several CAT scans, several MRIs, several x-rays, a colonoscopy, endoscopy. Yeah, I've had every kind of procedure that you could probably have as having a sickness. I'm just trying to explain this because I do have these issues, and the fact that I had to kind of hike down the trail so much kind of throws in with this, because I do think that there are residual effects that go with this, and it also is one of the reasons why I went into nutrition in the first place, was because of having this disorder. So, second time I stayed, I ended up having a lot of more procedures. It was for like a week. I got kicked out of one hospital because they thought I was faking, and they called the cops. And then I went to the second hospital, which they kept me for a week. So I will never use that hospital again. And they had a doctor there, and I'll always call him Dr. Quack because it was very similar. I'm not going to name names. Anyways, but he sucked. And there was one night, because they thought I had celiac disease. So celiac, if you don't know, a lot of people know now, you can't eat gluten. Back then, finding gluten-free stuff was very difficult. Now you can find it everywhere. Which makes me mad, because I don't have celiac disease. But one thing that is interesting is that they have found like kind of a link of gluten intolerance with psoriasis. And when my psoriasis started showing up really bad was when I started adding gluten back into my diet. I could test that theory, but I like bread and I like things like that. So I'll deal with it. I have biologics. It's fine. But nothing's gonna, it's a hereditary thing. Like, it runs in my family. So, on my biological father's side. So, I've been through the ringer when it comes to that. And, I've had every diagnosis that you could probably have. IBS, celiac disease, so many things. But the second time I went in, I had to have my gallbladder taken out. That's what they did. They took my gallbladder out, and the surgeon was the same surgeon that took out my appendix. I went back to the office for my checkup. He was like, okay, well, what are we taking out next year? I said, hopefully nothing. And I haven't had any other surgery since then. So that's great. And hopefully, if anybody else sees this and like they're suffering from a lot of illnesses like that, where you're throwing up and you're thinking that maybe smoking something might help, you're actually doing the opposite of what you should be doing. So that just is a little bit of my health issues and history and things. So if you see me running around with a knee brace on, it's because I have psoriasis. If you see me having no breath, it's because I have asthma. And if you see me running to the bathroom, it's because I have Cannabinoid Hyperemesis syndrome, and I believe that there are residual effects. And it could be that there was a little bit more going on there too. So I don't know. I haven't been to a GI doctor in quite some time. But now we're going to start cleaning the tent, finally, because I still need to get to the gas station to get more water and everything else.